All right. Aloha, those that just joined. Welcome to Hawaii Care Choices Healthcare Resource Talks. Today's Zoom meeting will be recorded so that others may access it in the future. Just wanted to let everyone know again, your cameras and microphones will be disabled at this time. Please use the chat box feature. Okay. Hello, Lani. Hi, Rodney. How are you today?
I'm good, thank you. How are
Awesome.
you?
Just wanted to let everyone know we're going to be doing polls today throughout our presentation. So I want to get started with that. A question will pop up on your screen. Please make a selection and submit your polls. I am going to start one right now so that everyone can get started. We're going to call this an icebreaker. Are you ready? Oh, great. I see everyone's uh, putting in their answers. I'm just going to give everyone a little more time. Oh, look, they're all flooding in. Okay, we got a few more people. I know it's a really hard decision. Okay, I got a few more people that just logged on, so they might be putting in their answers. Okay, we're going to pull it down in 5. All right, I am going to end the polling here, and I'm going to share the results with you. Do not worry, these are anonymous, but just a little fun that everyone can see. So we have 30% of you that would love to be a unicorn, 45% that would want to be a dolphin. Yes, especially in this humidity right now, I would love to be in the ocean. 24% of you would be monkeys. So yay, congratulations everyone, that was your first poll. Very, very easy. So we are going to bring those up again throughout our presentation, but I'd like to go ahead and introduce our special guest, our first special guest, Rodney Powell. Hi, Rodney.
Hello, good
Rodney
morning,
is
everyone.
a licensed clinical social worker and currently works at United Healthcare as a service coordination manager. He has worked in social services for the past 25 years with a primary focus on mental health and substance abuse, HIV/AIDS, and long term care. Rodney is of Polynesian ancestry and has traveled throughout the Pacific as well as lived in California and Utah. Hilo has been his home for the past 13 years, and 12 of those years has been with United Healthcare. Welcome, Rodney. We are so thankful you are joining us today.
Thank you. Thank you. Glad to be here.
Awesome. Can you tell us a little bit about your role with with United Healthcare?
Sure, no problem. So I'm a service coordination manager with United Healthcare, and I work with a team of nurses and social workers. And what we do is we manage Medicaid members that are covered by our health plan and who need support in the home to be able to live independently in the community. So we provide service like chore and personal care. We also support folks that are maybe transitioning or living in a nursing home or care home. uh, we make sure that we get connected with their doctors. We work with their providers, and we just try to manage the overall service coordination needs that they may have, so that they are wrapped with services. We have a very talented team of nurses and social workers who come from all different backgrounds, and they're all very closely connected with our East Hawaii community.
Awesome. Thank you so much for sharing that. And we are going to have a chance to do a question and answer session with Rodney. So if any of you have any questions throughout the presentation, please put that in the chat box as well, and we'll try to get to that in our question and answer. Our second special guest today is former Mayor Billy Kenoi, who'll be joining us a little bit later. Billy was mayor from 2008 to 2016. And before being elected mayor, Billy served as legislative aide in the state house, the state senate. He was a law clerk, a deputy public defender, and executive assistant for then Mayor Harry Kim. Billy is now busy as a husband, a dedicated father of 3 children, and a new puppy, Makana. Billy also continues to be a community advocate for Hawaii Care Choices, formerly Hospice of Hilo. We are so honored to have Billy joining us today, and we'll get to talk to him a little later in this presentation. So with that, I would like to turn that over to Lonnie Weigert, who will take care of the presentation on Know Your Healthcare Choices. Hey, Lonnie.
Hi, Tish. Thank you so much. And welcome, everyone. Welcome for joining us today. I really appreciate your time. And there's so much to get to. So let's just get after it. I'd like to share about our programs that we're offering. And in these uncertain times with COVID, it's so important for you to know your healthcare choices, because lots of times people would just go to the hospital, or they go to their primary care physician, which is absolutely fine to do. All of those places are still very much offering all of their services. However, now it seems that the consumer is changing the way that they want to access their healthcare. And I'm so glad that we are able to provide our services in the safety and privacy of everyone's own home. So let's get after this. What is palliative care? So patients with serious or life-limiting illnesses, and I'll tell you which illnesses we're talking about, because there's so many, but I would like to focus on some specific ones that we are currently serving our patients with now. The relief of these symptoms, such as a serious illness, cancer, let's say, there's always symptoms that come with that, particularly if there's going to be any treatments that will be taken during that time. So I'm going to talk about that as well. And also to improve the quality of life for both the patient and the families. When people ask why palliative care, it has everything to do with the improvement of quality of life. Now, who is appropriate for palliative care? Oh, okay, there we go. Sorry, we're just getting a little anxious. Okay, so anyway, who is appropriate is anyone with a serious illness such as cancer, CHF, COPD, and advanced kidney disease. These are the ones that we're focusing on now. And believe me, there are so many within our community that are challenged with these diseases right now. Patients can be of any age, and I think a lot of people didn't know that. We also serve children as well. So anyone dealing with any of these illnesses can come to us. We also, in this particular program, have patients that want to continue their treatment, such as chemotherapy, radiation, dialysis, etc. And that's fine on this program. So what ends up happening is really we're being called to serve our patients because of the symptoms that they get from these treatments. So, for example, those that maybe are going through radiation or chemotherapy, they may experience fatigue or nausea, or and even emotional symptoms as well. So it's important for our palliative care team to come in and really embrace not only the patient but the family as well, and of course for the sake of quality of life. So people can continue to do their treatments, and patients do not, I repeat, do not have to have a terminal diagnosis in order to be on this palliative care program. Unlike hospice, which requires a 6-month life expectancy, palliative care does not require that.
There's
It's
that
not.
poll, Lottie. It should be up. We'll just wait for those answers to come on in.
Okay, how are we doing?
Wow, they are coming in quick, Lonnie. We have a few more participants. These are coming in much faster than that other questions. I think the other one might have been harder. Choosing between a unicorn and a dolphin was always going to be my, that's such a hard choice. Okay, we have everyone done. So I'll just go ahead and take that out and let's share these results. 100% of you said it is true. The goal of palliative care is to improve the quality of life for patients and their families. Awesome.
Yay. So I was just checking to make sure everybody had their coffee or whatever was needed to make sure they got 100% on that first question. And I'm glad everybody did. So let's just dive in deeper so people can understand even further. I'm glad that you folks realize that quality of life has everything to do with why somebody wants palliative care. So this is what happens is when people think, I don't know, when would I need palliative care? Well, there's certain signs that you can see either yourself if you're the patient or as a loved one or caregiver. So if the patient tends to go to the emergency room frequently, and when I say frequently, it could be several times in 1 month, or they tend to be calling their doctor, not during normal business hours. I'm talking, all hours of the night and just different things that make a patient feel anxious that they need to be calling their doctor a lot. That could be a sign that palliative care is needed. Difficulty managing their medications. After a while, there's so many medications that they get confused as to, should I take this one or this one, or maybe I should just take them all, and then it just compounds the symptoms that a patient is dealing with. The physical signs, diminished activities of daily living, really managing finances, meaning it's difficult to do one's checkbook, driving, where am I supposed to be going? At the grocery store, not really remembering what you're supposed to get, or it's even difficult to walk from the car to the grocery store. And then preparing meals. After a while, you don't want to prepare meals for yourself or you're unable to. So you definitely need someone to help you. Light housework as well. Like after a while, everything sort of just goes to the wayside because you're just not feeling up to doing anything. Going out and cleaning the yard, which might have brought you a lot of joy, is just something that you don't feel up to doing. So the kinds of feelings that people have are pain. Pain is one of them, and fatigue, always feeling tired, sometimes swelling in the feet and legs, and also the feeling of nausea. Anxiety and sleeplessness are other symptoms too that tend to come up as well. So when somebody is dealing with these types of symptoms, maybe it's time to call your doctor and see if palliative care is something that could help you with. So people will ask, so when should I call? When, let's just say I'm dealing with COPD and I've had it for a while. Do I need palliative care? Because I seem to have been dealing with my symptoms well. I'd say yes, you probably need palliative care. And then throughout the course of the illness, it's good to call at any time. Many times people will say that So when you get your diagnosis, say you get your diagnosis of cancer, whatever stage it's at, that would be a good time to sign up for palliative care, because once you become familiar with palliative care, then it's not so scary to have it. In fact, you start to look forward to having your palliative team come over and really helping you through these symptoms. So the serious medical issues people tend to live with, but the earlier you sign up, the better. Tish, is there any um, questions in the chat box possibly for Rodney at this time? Oh, you are muted.
Thank you, Lonnie. No,
No problem.
just a little technical difficulty. Yes, there are questions that are flooding in. So I will definitely ask one of these for Rodney. Rodney, what type of services does United Healthcare provide?
Well, we provide service coordination, and under service coordination, we have the long-term services and support program, and then we also have our special healthcare need program. Both of those programs work with our very marginal folks that are in the community that need a lot of support, either in the home or with any other community supports that might need coordination of their care. So we work with their doctors, we work with their providers, we work with any of the programs that they're involved with. We also try to work with community supports that are just naturally available in the community, and try to get them connected. Really try to specialize and individualize the service plans that we come up with to better suit their needs and make sure that they are using the benefits that are available for them within the health plan, and also accessing the benefits that they might qualify for with other programs in the community. So, like working with palliative care is one good benefit that they might have access to. So, if we identify that need, then we do definitely make the referral, have the doctor get involved so that they can get connected with the palliative care program. And then we work closely with the palliative care team to make sure that we are wrapping all the services that are available for that person.
That is awesome. Thank you, Rodney. I have one more. Lonnie, is that okay if I ask the second question?
Okay, go ahead.
Okay. What other community organizations do you work with serving our community and your members?
Okay. Well, we do work with the majority of all the primary care physicians. We work with the day clinics. We work also with the Hawaii Family Health Center, the Hilo Medical Center. We worked with the hospital. We work with the community case management programs, so that's like the mental health and behavioral health programs under the Adult Mental Health Division. Also the like Care Hawaii, Mental Health Kupua. We also work very closely with Neighborhood Place of Puna. We work with the shelters, Hope Services. We really try to expand our network of provider to all of our providers, and also find the community supports out there. We High Half is another example. We're with the HIV/AIDS Service Foundation. We also have a lot of members that they service, so we try to coordinate the care with them. Yeah, I mean, pretty much if there's any kind of community program that's out there, we try to make that connection with them, because somehow our members may be involved with those programs as well.
Okay, thank you. Wow, that's a lot of organizations that you guys partner with. So thank you.
Thank you so much, Rodney.
You're welcome. Thank you.
So, for everyone, what to expect when you sign up for palliative care. So, I told you why you should sign up, which was, if you needed help dealing with your symptoms that occur because of your serious illness. Well, let me just explain to you a little bit about how palliative care works. Once you sign up, or your doctor refers you, or even you may call us directly yourself, one of our nurses will come to your home, and she'll take your vital signs, etc., trying to get your health and medical history. And then we'll also have a nurse practitioner come and do a full head to toe evaluation as well. But for the most part, what's really interesting about this meeting is that we want to know what your biggest concerns are. So, in other words, it can be as major as I want to be well enough so that I can go to my family reunion out in um, Los Angeles, or I want to be well enough so I can go and watch my grandson play football, or I want to just not be huffing and puffing to get off of my couch and walk to my mailbox and get the mail and be able to do that without becoming completely breathless. So we want to help in those kinds of goals. We want to hear the human side of what you're dealing with. And also, the reason we want to know is because our approach is completely and totally holistic. We are not only serving the symptoms that you have, we're serving you and all of the emotions that you're going through as well. So palliative care is not something that people were really familiar with prior to that. In fact, nobody even uses that word palliative care, but I want you to know, listen up for it because it is trending big time and many people are utilizing palliative care not only to boost their quality of life, but for many, it's to live longer as well. So, educating patients and family is one of the big things that comes with palliative care.
Lonnie, I have a question. Are these
Okay.
services, are the same services available on outer islands?
No, these services are offered by Hawaii Care Choices specifically to the East Hawaii community. So on different islands, in different regions, they may offer different types of programs, but not everybody offers palliative care. So for those of you who are tuning in that live in the East Hawaii area, which is Lapahoehoe Point all the way to Kau, I am so glad that you tuned in because we are able to provide you these services here. I think in other parts of this island, palliative care is coming to the forefront, but it's difficult to provide it on a at-home team basis. And so we're very, very grateful that we have been able to provide it thus far.
Thank you so much, Lonnie. I hope that
Okay.
answers your question.
Okay, thank you so much. As part of palliative care, there is a medication review that the uh, palliative care team will do. The reason that is in this crazy world of healthcare, somebody who has a serious illness, say congestive heart failure, CHF, they may go to their primary care physician and receive medication. But then maybe they are also going to see their cardiologist and they get medication there too. Then there is some kind of event that happens at home and they can't breathe. So they go to the emergency room and they get medication there. And then they see possibly another ologist and get more medication. So understand all of this medication and all of the doctors that are providing the medication are not checking with each other. And neither is the pharmacy. All of this medication is being given to a patient, and sometimes they could have anywhere from 25 to 35 different jars of medication. We have been in homes where we have had the entire coffee table just filled with medication bottles. And some of these jars are expired medications. Some belong to the deceased ex-husband. Some belong to the adult children that no longer live at the home. And then there's a whole plethora of other medications that's there. So it can be very confusing to anyone that's trying to navigate themselves through which medications I'm supposed to take. For the most part, a lot of times people keep all of their medications because it's so expensive to have these medications, so they keep them. But I want you to know that oftentimes when people get confused with which medication they're taking, it can compound their symptoms. And therefore, when the palliative care team comes in, we're able to review all of the medications, contact the primary care physician of the patient as he or she is the lead on the team, and then start to streamline only the medication that a patient should be taking, and largely that can immediately relieve 10% of some of the symptoms, particularly, let's say, someone has sleepless nights, or maybe are experiencing swelling in the legs or feet. So these having a palliative care team is very, very useful, and it does in fact boost the quality of life. How does palliative care work? So we're coming in, our team is coming in, and we are looking at the pain and symptom management. So we'll come in and somebody will say, well, today, my pain between the range of 1 to 10, it's really a 7 today. And I don't know why it is. I've been taking this medication for this time, etc. Well, your palliative care nurse will take a look and then reach out to your doctors to see if there could be a better solution for you. So we're trying to help you manage living with the pain and also symptoms that you may be dealing with, such as nausea, or I'm really tired today, or my body is really sore. All of these things are very common with regard to the serious illnesses in which I have spoken on. The other thing that's important is the care team will come and help coordinate, because a patient is normally seeing more than their palliative care or their primary care physician. We oftentimes will help the patient organize all the craziness of, oh, okay, and you got to go see this doctor, and now you got to go see that doctor. Maybe you're doing physical therapy, maybe you're getting home health. All of these different services need some kind of coordination, and we're part of that team that will help you do that. There is a plan of care that we create once a patient comes on our program, and that plan of care has everything to do with how often we come to see you, all of the different ways that we're trying to help you, and different things that you will need to follow, such as we would talk to you and educate you about your diet or nutrition. There could be in there when you should take certain medications and why you're taking them, just in case you forget, you can refer to your plan of care. So this really drives how we are caring for the patient. And it helps the caregiver as well to follow along. We could help with insurance forms, say if a patient would like to or needs to sign up for Medicaid, our social worker can come in there and help as well. And if a patient does not have an advanced care directive, we can also help with that in the home. If spiritual care is needed, we certainly can provide that as well. So how is palliative care paid for? Now, depending on what kind of insurance a person has, or if they have Medicare and Medicaid, could determine whether or not they have a copay or not. Rodney, can you share with us a little bit about how it works for United Healthcare if somebody is receiving palliative care services? Is there a copay?
The copay would depend on the MedQuest division's eligibility determination, right? So when you apply for Medicaid, based on your income, your assets, the MedQuest division will determine if there's a copay for services, and that's directly between the MedQuest division and the member. What we do is we are informed of that copay, and so we try to support the member to understand that, hey, you might have a copay with this service, but really we try to just encourage them to communicate with the MedQuest division so that they have an idea of how their copay might be impacted based on their eligibility.
Thank you so much, Rodney. We're going to actually come back to you on that Medicaid qualification, because that's something that many people do have questions about. Thank you so much. So back to what portion can be covered with regard to palliative care. For the most part, depending on what your insurance coverage is, there could be a copay, and say if you have Medicaid as well, maybe there won't be a copay at all. So it just really depends. So it's important to know that having some kind of insurance coverage will really play a part in how this gets paid.
Lonnie, I have a quick question before we move on. Who provides the spiritual care?
So we have our spiritual counselors, our chaplains, our licensed chaplains on our Hawaii Care Choices team. And so if somebody needs some spiritual care, then we would definitely send one of our spiritual counselors out there. Let me give you an example of why somebody would need spiritual care. So, say there is somebody that is experiencing other kind of pain, not necessarily physical pain, but spiritual pain on, I feel so sad that my adult children keep complaining or arguing over the land, and I can hear them doing that. Or, oh, I'm so sad I didn't tell my dad I loved him before he passed away. Or just these emotions that we harbor and we carry along with us that maybe we need some help clearing through for ourselves. And so we found it to be very, very helpful for people to have some spiritual care to come and guide people through different types of pain as well.
Thank you, Lonnie.
Tish, I was thinking, is there no brain teaser yet?
Oh, let's see. It will be coming up shortly.
Okay, I just want to make sure that we don't go too far and then we forget about those. So I'm going to move on now to hospice care. But if there's any questions on palliative care that you still have, please send it in the chat to Tish so that she can share it and then I can address it with you folks right now. So what is hospice care? This is what's really important about hospice care is that people think that if they sign up for hospice, it's because they've lost all hope and hospice equals death. I want you to know that oftentimes people are dealing with a serious illness that is going on its natural progression. And somebody needs just a higher level of care, which is why hospice care is called in. It is not a mandate to uh, die on hospice care. Many people will come into hospice care and then graduate because they no longer need hospice care. So it's very, very important to know that hospice care is really getting the highest level of care if you need it, and it's provided for you there. So hospice care treats the person versus the disease. And why that is important is because by the time hospice care comes in, it's for someone who no longer wants to do any kind of treatment. They want to continue to go through the natural course of their disease, and they do not want to do any kind of heroic treatment such as chemotherapy or radiation, dialysis. They're just done with all of that. There's a different philosophy for hospice care. It is under the umbrella of palliative care, but the philosophy really focuses on the quality of life, not the quantity of life. And this will come up many times amongst families who will say, well, mom, I want you to keep doing chemotherapy, because I want you to live longer. However, her quality of life maybe sliding down the hill just really quickly, and she's losing weight, she's in pain a lot, she can't sleep, her quality of life starts to diminish. And so when hospice care comes in, the choice can be a beautiful transition where the person can naturally go through the course of their disease and not have to diminish whatever quality of life that they have left. So that is a philosophy change once somebody chooses hospice care. Also, hospice was really created to ease terminal suffering. Okay, because a lot of people are in a lot of pain towards the end of their life, but they don't have to be. Hospice care is there provided for anyone who needs it. So many times people associate hospice with death, but actually, hospice is on the scene to ease terminal suffering. It also eases emotional and spiritual stress. And for the most part, hospice comes in and provides comfort that everyone really wants.
Lonnie, I do have a question for you and for Rodney. Do either United Healthcare or Hawaii Care Choices accept Kaiser?
So for hospice care, we do accept Kaiser. We accept all insurances, including United Healthcare as well. And in fact, I don't know if there's another question for Rodney in the chat box. Okay,
Yes,
go
there
ahead.
is. So I have to, Rodney, does United Healthcare accept Kaiser? Is the question?
So Kaiser is a health plan, and United Healthcare is also a health plan. So we will work together. There's a mutual member that might be transitioning from Kaiser over to United Healthcare for insurance coverage, or vice versa, they're transferring from United Healthcare to Kaiser. However, it's two separate health plans. Yeah, so I mean, our work together really is just in coordinating any kind of transition of care for.
Okay. Okay, awesome.
Great.
The second question that I have is for Rodney. How does United Healthcare support our community during COVID-19 pandemic?
So during the COVID-19 pandemic, our nurses and social workers who are very connected with our providers and also the membership that we serve, we really went out there and started to get an idea of what the provisions were around COVID-19, especially with the nursing facilities, with the nursing agencies that we work with. And then we started to make sure that our members were well taken care of. So there was a provider that was no longer going to be able to see a specific member because of COVID. We try to make sure that that member then gets connected with a different provider or is still receiving the same service and benefit, so that there's no break in their care. We're also working very closely with the MedQuest division with the CDC guidelines to make sure that all of our services continue despite the protocols that have put in place and the emergency orders that have come out. So we really try to lessen the impact on our members because of COVID to make sure that we can continue to provide the basic care that they need.
Wonderful.
Okay, thank you so much.
Thank you so much, Rodney.
Thank you.
Okay,
All right, so let me just continue on. So what is hospice care? I've shared with you with regard to the philosophy of hospice care and how hospice care is providing a certain type of care to those that are dealing with end of life. However, many do get better and just continue to live on very active lives. And so we wanted to also share that similar to the palliative care program, we also have a hospice care team. And this is what you are seeing on your screen right now with regards to the different people that is part of that team. And this team is created really to embrace and surround the patient and the family and make sure that they have the support and guidance and love to really take care of the patient. So who qualifies for hospice care? So someone who is suffering from terminal illness, we will need a doctor to give the best guesstimate of 6 months to live. So there is a 6-month life expectancy required for anyone who wants to come on hospice care. And then for patients who are no longer wanting to seek curative treatments. Now, I remember when my father got congestive heart failure, and his only wish to us was that he wanted to pass at home. And so we thought, oh, piece of cake, Dad, we got that, no problem. Anyway, one evening, he couldn't breathe, and we called 911, and he got swept off to the hospital in the ambulance. And sadly, by the time that we had reached the hospital, he had already passed. Now, that was an epic fail for the family, and we were quite disappointed that we were not able to fulfill his final wish. Years went on, and my mom had contracted lung cancer, and as she was going through her treatments, her doctor said to myself and my brothers that, oh, mom is ready to have hospice care now. At that time, I was not familiar with hospice care. And so I said, oh, what is that? And he started to explain, oh, you can have it at home, and mom doesn't need to have any treatments and all. And I thought, oh, gosh, that sounds good. And then I said, well, I know my mom's not going to be game for it. And he goes, well, why not? I said, she's Hawaiian. But anyway, what happened is that I go home and I said, Mom, guess what? You can have hospice care. She goes, oh, hospice care. I can't believe you even brought that up. I don't even like that name. I'm going to live long time. I don't even know why you brought that up. We don't need that. I said, oh, okay. So you're not about hospice then? She goes, no, I don't need that. I said, okay. Well, I heard, Mom, that we can get free stuff. She goes, oh, like what? And then that's when I explained to her, Mom, we can get the oxygen, the bed, there's a whole team that comes. We don't have to go see the doctor anymore. And so she says, no, that's some kind of gimmick. I know that's a gimmick. They're going to charge us later. I said, no, Mom, it gets paid by your Medicare. Oh, the government? Oh, no, they guarantee they're going to send us the invoice. I said, no, okay, so how's about if I check it out and it is included in your Medicare? What do you think? She goes, oh, I think we should get it because we may as well take advantage. I said, okay, good. So we did. And as the weeks and eventually the months went by that my mom's life was extended, she said to me one day, she goes, oh, I'm so sad that Daddy didn't get this. Oh, this is so wonderful that I'm getting all of this care. And I said, yeah, I know. And she says, so you know what? I want you to go out there and go tell all the neighbors in Hawaiian Homes over here that they need to get this hospice. I said, well, actually, it's kind of a little awkward. For me to go out there right now and go ask for that, and tell people that. I said, she goes, well, you figure it out. Because I know there's going to be a lot of people that don't know about this hospice, and they're going to have their end of life, and they're not going to have a good end of life like I am. I said, okay, Mom. So what ends up happening is here I am 10 years later doing this, where I'm sharing the education of how wonderful hospice care can be to any family. And I do this not as a duty to my job, but as a promise to my mother. So I know firsthand now how wonderful this system is. And when I think about how so many people end their life without having hospice care. So let's continue. Oh,
There's the poll, Lonnie. We got it. All right, so there is one more question on top of your computers. I see that many of you are just quickly going in there. I'm so glad everyone's still awake.
yeah, me too.
Lonnie, can I just put a little plug also for hospice?
Oh, yeah, go ahead.
So my tutukane was under hospice recently, and he passed with the support of the hospice program. And it really eased the mind of my parents and my uncle when they were involved. They were reassured that there was a nurse that was available. They were reassured that there was counseling support that was available. So I am also a firm believer in the hospice program, that it really does provide the comfort and support that somebody needs in their last days.
Thank you so much, Rodney. Thank you so much. I found that people will share with me about having the hospice team come in, and husbands and wives that have lived together for years, and all of a sudden she has to figure out how to give a bed bath, or how do I turn my husband in the bed? I don't know how to do that, or I'm gonna feed him, in the bed now, and just all these things. um, Many people often share how relieved they are to have the guidance and support to take care of their loved one, which is really a big part of our culture, to take care of our loved ones in their time of need. So, Tish, any result?
Yes, we do. Okay, so I will go ahead and end the polling. Here is our results for our poll. Hospice is where you go in your last days. So we have 22% saying yes, that is true, and 78% saying false. Lonnie, can you share a little bit more on this, please? Thank you, everyone, for participating.
I'm so excited to be able to respond to that, because what ends up happening is, in the times where people think hospice equals death, they think that it's time to call hospice in the final days, when in fact times have changed. Understanding of hospice and why we need to call them early is to really extend the quality of life, and sometimes, oftentimes, extend the loved one's life as well. So calling us as soon as somebody gets their 6-month life expectancy is a really wonderful thing to do, versus calling us in the last days or hours, because really what happens is, we're there to help the family and the patient. And what tends to happen is, when somebody is approaching end of life, the family needs a lot of support. Particularly to prepare for the event of the loved one passing. And so when we come in, we're able to provide the strengthening, the resilience that the family will need once that event actually happens. If we are called in the final days, it's just impossible for us to come in and help a family and get them strong and ready, to deal with that. And I really liken the services of hospice to, say, if we were all on a flight on Heaven Airlines. Our destination is already determined, and some of us will go at 2 p.m., some will go at 4, some maybe at 8 p.m. But make no mistake, we're all going to go. And in this Heaven Airlines flight, anyone that has signed up for hospice, that patient and their family will go directly to first class cabin. And the reason they will go to the first class cabin in that flight is because that is where all the comfort is. All the comfort for the patient as well as the family. Sadly, for anybody else that for whatever reason did not sign up for hospice, they will not go into the coach class of that airplane. They will actually go into the baggage compartment of the plane. And the reason that they'll go into that compartment is because that is the roughest, coldest, toughest ride to the very, very end. And not only the patient will go there, but all the family will go there as well. The patient will cross over the bridge to heaven, and the family will have to take that horrific flight back. And oftentimes, when they arrive, they are in a million pieces. So we say to everyone, please call us early. Please call us early so that we can wrap our aloha around everybody in the family. And so they too can have a first class experience. Next slide, please. So when is it time for hospice care? Normally, you can see that somebody needs hospice care if they tend to be going to the emergency room or needing to call the doctor a lot. You can also see physical changes that they're losing weight. Maybe they're becoming quite unsteady and they're falling a lot. They tend to not want to drink anything, or they don't want to eat. Sometimes they even forget to eat at all, and they tend to have difficulty getting in and out of bed or maybe even in a chair. They often are sleeping most of the day, or even sitting up they can just fall asleep. And you'll also notice that they will have different types of infections, both skin or urinary tract infections, other types of infections that tend to show up as well. So care is provided at home, which is such a beautiful thing right now, because with COVID-19, those that go to the hospital or even the long-term care facilities, they have very, very strict regulations with regard to more than one person coming to visit the family. And so oftentimes many people will opt to have hospice care at home where all of the family can continue to support them and not be held away from them. Also, all of the medications that are associated with the diagnosis that one goes into hospice for is also included in the hospice care, along with all of the equipment, oxygen, the hospital bed, anything that is needed. And also, if a person decides that they want to continue to see their primary care physician, they certainly can. And so when somebody signs up for hospice care, we will come to the home and we will create that plan of care. Again, the holistic approach on what's important to you, what's important to your family, the caregivers that are there. A plan is created so everybody in the home can be following that plan, as well as everybody on our team. As well, when we come to visit. And remember, we have quite a few people on the team with regard to the registered nurse, the certified home health aide, and our spiritual counselors, our social workers as well, and our nurse practitioner that comes to visit um, in addition to the rest of the team.
Lonnie, I have a oh, and there is our poll. And I actually have questions, some for Rodney, some for Lonnie. I'll start with
Okay.
Lonnie. Does Kaiser cover hospice care also?
Yes, it does. In fact, hospice care is a benefit provided by everybody. Veterans Administration, of course, United Healthcare, HMSA, uh, and it's covered, of course, under Medicare as well. But everybody has a hospice benefit, and it is just as I described it to you. Everything will be included, and again, you don't want to miss that first class experience when it comes your time.
Yes, thank you, Lonnie. Rodney, can if someone wanted to receive United Healthcare coverage, how would that help them if they need palliative care?
Well, how would having United Healthcare help them if they had palliative care?
Yes.
Well, the fact that we work very closely in our partnership with White Care Choices is a big benefit. We have weekly meetings to discuss the care of the members that we serve together. We talk about the benefits that they might qualify for or might not qualify for, and then we try to figure out ways to have access for them. Yeah, so our partnership with Hawaii Care Choices goes way back from the beginning of MedQuest Quest Integration contract, and so we do a lot of partnering with them to make sure that they have access to those benefits.
And you guys have been great partners. Thank you so much, Rodney.
Thank you, Lonnie.
Thank you. I have one more for Rodney. While we still have a few more people putting in their polls, Rodney, a participant has United Healthcare already, but hasn't heard much about palliative care before. They have COPD for years. How would this person benefit from getting palliative care? Or, I'm sorry, that was, yeah.
So, one of the major benefits they would, especially with having COPD, is that that palliative care team, once referred to the team, will sit with them and conduct a full assessment to determine how they can support the person with the COPD and also with the family with managing any pain or discomfort associated with the COPD. And really, the goal of the palliative care, like Lonnie was saying earlier, is to improve the quality of life. Um, they help with the coordination with the doctor. They help to understand the medications, the treatments. And I've sat in where our palliative care team has done an intake with one of our members, and it was very thorough. And the one thing that I got from that visit was our member was able to ask the questions to our palliative care teams that they might have been afraid of to ask their doctor because the team had a very soft and very supportive approach. The member felt very supported and comfortable with asking those questions. And then the team was able to direct the person on how to maybe ask that question to their doctor so that the doctor understands where that person might be coming from with that question. So that's the benefit of partnering with our UHC team and also with the palliative care team.
That is awesome. Thank you so much, Rodney. I just want to reiterate for everyone who wasn't able to join right in the beginning of our presentation. Again, Rodney Powell is a licensed clinical social worker at United Healthcare. He currently has been working there for 12 years, worked in social care for the past 25 years. With a primary focus on mental health, substance abuse, HIV/AIDS, and long-term care. So again, thank you so much, Rodney, for your wealth of knowledge that you've been sharing throughout this presentation. Right now, I'm going to go ahead and end the polling and share those results. So the question was, my culture expects me to take care of my family with healthcare needs at home. As you can see, there are varying answers. Lonnie, would you like to elaborate on anything?
Yes, thank you so much, Tish. It's so good to see how varied the responses are with regard to that. Culturally, many people are expected to take care of their loved ones at home. And as a result, many do not reach out for support and help that is available to them so that we can come into the home and help. And there's nothing wrong with that. There's nothing to be shame about with regard to, oh, I couldn't take care of my mom alone. I've heard from many caregivers, particularly a woman who was taking care of her dad, and he was very serious, and she had a very heavy workload as well. And she was just going crazy trying to take care of her family plus take care of her dad, and feel guilty every day that she couldn't really help him to the point that she was relieving his symptoms, until one day she decided, I do need help. And she just reached out to us. The biggest takeaway for her was that not only did we come and embrace her entire family, give her the support that she needed, make her dad comfortable to his last breath, but also she was able to become his daughter again and just love him, where she was no longer trying to be in charge and the person that was leading, everything. She didn't have to know all the answers. She could just be in the room with him, hold his hand, and just love him. So I'm so glad that the idea of reaching out for help is starting to open up for many of the families, irregardless of whatever culture that you grew up in. my message to you is call us and call us early. Okay, let's continue on. We're just about finishing here. I'm just going to say something really quickly about our inpatient facility, which is super beautiful. I'm excited that Billy Kenoi has joined us as well. So I'm going to be finishing this up so we can get to some questions with him as well, so he can share his perspective as an advocate for the kinds of services that we provide. But first, I just wanted to share that I don't know if you folks know of Bohai Malama Care Center, but it is such a beautiful place. I mean, we built it with royalty in mind for sure, and everything is koa and all. And people will tell me it's so beautiful. It's the Mauna Lani of hospice for sure. And people will say to me, "Oh my gosh! I mean, can I make reservations?" Well, I want you to know that by the time somebody comes to Bohai Malama, it's because they're very, very seriously ill. So you probably wouldn't want to make reservations, but it is a beautiful place for somebody to come and get their needs served. So what happens is somebody that could be on hospice services, maybe their symptoms cannot be controlled at home. And so they come to our in-service facility here, our care center. This care center is not a long-term care facility. People come here maybe on an average for 14 days or so. They either get better because we have stabilized their symptoms and go home back to their loved ones, or they will pass here. So this is a transitional type of care facility, and people can come here. The insurance normally will cover the hospice part of your care, but room and board will normally be covered by Medicaid. So anybody that has Medicaid or would like to get Medicaid, it's good to look into that now. And finally, how hospice care is paid for. It is so wonderful. Hospice care is paid for 100% by Medicare if you have hospice care at home. So do not hesitate if you know anyone that needs this care. It is absolutely amazing to have this first class service all covered for you. So all I say to you is call us, call us, call us.
Right. Thank you so much, Lonnie. Again, if anyone has any questions about palliative or hospice care for Lonnie or anything United Healthcare related for Rodney, please enter that in the chat box now. As Lonnie mentioned, we have Billy Kenoi, who has joined us as our second special guest for this morning. Billy is the former mayor from 2008 to 2016 before being elected. Oh, not yet, not just yet, no. Before Billy was elected mayor, he served as legislative aide in the state house and the state senate. He was a law clerk, a deputy public defender, and executive assistant to then Mayor Harry Kim. Billy is now busy as a husband, a dedicated father of 3 children, and a new puppy, Makana. Billy also continues to be a community advocate for Hawaii Care Choices, formerly Hospice of Hilo. Billy, we are so honored to have you join us today. Oh, hold on. Let me just get you on unmute for a second. Okay, of course, now that doesn't want to work. Hold on one second, Billy. Just trying to unmute your microphone here.
I wonder if he can unmute it up from his side.
If you can, that would be great. So sorry, everyone. We are having a little technical difficulty. While I try to unmute. I do see in the chat room a message for a question for Rodney. So let's go to that real quick, and then I'll try to get Billy back on if you don't mind. Okay. Rodney, this person is 65 years old, already has Medicare. How could I qualify for Medicaid, and what are the benefits of Medicaid?
Well, the good thing about Medicaid is that you don't have to be any specific age to apply for Medicaid. The applications, like I seen earlier, are done through the local MedQuest office, and then the MedQuest office determines that person's eligibility for Medicaid, and then provides them with information on how to choose a health plan as their insurance provider. Having both Medicare and Medicaid is good because services such as doctor's visits, hospital care, home care, skilled nursing facility care, they're all covered both by the Medicare and Medicaid plan. Again, like we were talking about earlier, there might be a cost share, but of course that's determined through the eligibility process when a person applies for Medicaid with the MedQuest division. We have a lot of folks that are dual, so they have both Medicare and Medicaid insurances. And if they do have a Medicare plan, for me, I work on the Medicaid side, but if they do have a Medicare plan, we try to reach out to that Medicare plan provider to also try to coordinate with that service provider on what benefits they might be able to access.
So, Rodney, sometimes we get questions from people that will say, so I take care of my adult father. He owns a house right down the street. He lives with us now because I'm taking care of him. Okay. Okay. We're getting Billy back on. All right. Okay. So, in any case, can you tell us a little bit about if somebody owns any kind of property, if that's going to be a problem to qualify for Medicaid?
Yeah, so like I was saying earlier, when you apply for Medicaid to the MedQuest office, on the application it asks for all your assets, income. So that includes property, that includes any Social Security or other types of income that you might be receiving. And then based on that, the MedQuest division will make a determination on whether or not you qualify. And they have different Medicaid programs. They have the Slim B program. They have other programs that you may qualify for depending on where you fall in on the eligibility bracket.
Okay, great. Tish, I don't know if is there another question? I know that the Medicaid thing seems to be confusing to a lot of people. That's why, Rodney. So that's why I wanted to ask you that. Also, there is another question that came up in the chat, which was my friend's granddaughter was just diagnosed with a rare type of cancer, and she's only 10. Would she be appropriate for palliative care even though she is a minor? And would she qualify for United Health Care coverage?
Yes, definitely both. Palliative care has no specific age requirement, and as long as you qualify for Medicaid and you're covered under United Health Care, then you can also qualify for service coordination and any of the Medicaid benefits. And like we were saying earlier, we work very closely with the palliative care team to coordinate the care between both sides. The palliative care team provides the support for treatment, such as chemotherapy and radiation. And the good thing is you don't have to be terminally ill to receive those benefit services.
Oh, yeah. Okay. Okay. And so, do your coordinators head out to the house, or is it how do they make contact with your United Healthcare members?
Yeah, so what we do is when we get referred for somebody that has a service coordination need, we reach out to them. We set up an initial appointment to go out and assess them. We have the social worker and the nurse do the initial visit to make sure that we understand person holistically. And then from there, we determine what kind of services and benefits they may qualify for. And then we develop a service plan to make sure that we're working off of that plan together. And the main thing is to keep the member independent in the community and wrap them with the services that they need to remain independent.
Awesome, Rodney. Thank you so much. Rodney, thank you so much for really just staying with us on the entire presentation, because we've asked you quite a lot. I hope we just didn't overstay or overextend ourselves, with
Not
you.
at all.
We really appreciate. Thank you so much. Okay, back to Tish. Tish, are we ready?
All right. Yes, we are ready. I apologize for those technical difficulties. We have former Mayor Billy Kenoi joining us. Thank you so much, Billy. Billy, can you go over why you became a hospice advocate many, many years ago, as I am told? Oh,
aloha. You can hear me.
Hi, aloha. Yes, we can. Hello, welcome.
When my dad was diagnosed with terminal lung cancer, me and my family were, my sisters, we were all challenged, my mom, as to what to do. And hospice came in and provided this thorough, comprehensive, entire spectrum of care that didn't only help my dad, but it helped our entire family. Counseling, spiritual advising. It was probably the toughest time of our family's life, and hospice made it a special time. So we went from all being confused and lost and not knowing what to do, all of a sudden being comforted, feeling great, and every hospice person who came to our home was somebody awesome. And from then on, I've been a hospice advocate. My time during mayor, Brenda could call me about anything, and I'd be there, just because of the amazing work that Hawaii Care Choice or hospice does in our community. I'm a big advocate, have been since that experience. And I remember being next to someone who was a bereavement counselor. And I said, hey, what do you do? He told me, oh, I work at hospice and I help people. And he goes, hey, Aaron, work with your dad? I said, wow, Brian, work with my father. And he told me, And I said, thank you so much for taking care of my dad. He goes, you know what your dad would teach me? I still use him with my other clients today. I go, what? He goes, I was talking to your dad about life after death. And he stopped me and said, hey, I would talk about life after life, not just life after death. And I thought that was really cool. So I'm a big fan of the care it provides. And, I've gone to a lot of TED Talks. Watched a lot of TED Talks about, the trends of healthcare, palliative care, the different models of healthcare. And going through what I've gone through these many years, you see the real value in the service, care, and support that all of you provide to families across our island. And you take what is probably the most difficult part of our lives and make it really easy for us to transition. Yeah. Can you hear me? Am I okay?
Yes. Yeah. Billy, we can hear you. That was so wonderful. Thank you for sharing that. Again, if anybody has any questions for Billy or Rodney or Lonnie, please enter it into the chat box now, and I will try to get to it as soon as possible. I know that, Billy, why do you think people are reluctant to utilize hospice services? Can you share your thoughts on that?
I definitely could. I think people get a sense that, if you engage in care with hospice, it's like waiting, it's like enough, it's like, oh, I'm just going to go die. And it's not the case at all. And I think people are afraid that like it's giving up. When really what it is providing quality of care and quality of life with the time you have. And I think we get used to this age-old medical model of, hey, you get sick, call an ambulance, 911, go to the hospital, But for those of us, myself included, with serious medical challenges, a visit to the ER, a visit to the hospital could be 3-4 months of IVs, tubes, tests, and in today's COVID environment, going to the hospital you're detached from your family, regardless of your condition or care. And so I think that's one of the challenges, that people think calling hospice, engaging hospice's services is just waiting for die. And that's not what it is at all. What it is improving your time you have. It's working with wonderful people with a lot of care, compassion, and expertise. Just think about what it takes to work, in that environment. How much love you gotta have for your patients and clients. How much care you gotta have for your profession. And so, I am, I would tell everybody out there that if you're scared, call, talk story with people, because getting tubed up, and being stuck in a hospital bed and being endlessly cared for in a high intensive medical setting, I don't know if that's the best quality of life.
Mhm.
I choose not to be in a high intensive medical setting. And, I get to savor every single day with my family. And that is priceless.
Mm. Yeah.
I really agree, Billy. Thank you for sharing that. Could you speak, if you could speak to those who may be on the fence about calling Hawaii Care a choice, what would you say to that person?
Oh, I would, I won't come down volunteer Hawaii Care Choices. Somebody call, I'm going to take that call and I will rap with that person and they're going to come in. Because, I should come down volunteer. You guys have done so much for my family, so much for my father, so much for me. What I would say is make the call, come down, ask all those difficult, tough questions that might even be hard to have with your own family. Call Hawaii Care Choices, speak to a counselor, a representative, so that you understand what palliative care means, so that it's not giving up, it's not quitting. You still get medical support, you still get medical care, nurses still support you. You're just not doing it in an intensive medical hospital setting. You're doing it at home. And even to this day, every day that I wake up and I'm in my own home, I can kiss my kids, play with my puppy, go down, even stay in a car in a COVID environment. But I'm home. And I'm home because I choose not to be in that intensive hospital setting. And I choose, a better quality of life. And also, Hawaii Care Choices, I think what people don't also understand is that there's this full wraparound care that comes with it. It's not just, medical or life or death, but it's spiritual advising. Um, you know what is really cool? I think people don't know about hospice, that, it's a difficult question. death, dying, you know. But if you die at home, say without Hawaii Care Choices, you're gonna have police officers come, right? It's a potential crime scene. Going to have an investigation, going to have yellow tape, going to have difficult questions of family members who are already freaking out at the situation. You know, going to have an autopsy. Autopsies are mandatory. You know, going to have a whole slew of official action that can all be bypassed by being part of Hawaii Care Choices. You know, where all of a sudden, instead of all of that, you know, traumatic experiences, you actually have the opportunity for your family to be part of your transition. And, you know, Hawaii Care Choices takes care of everything. And to me, just removing that trauma from the experience of dying is priceless. You know, that you can prepare for that ahead of time without all the chaos that ensues. Just like how you plan for your career, just like how you plan your profession, you plan for your family, you plan your financials. I think a lot of us don't plan for the inevitable. It's something we're all gonna have to address at some point in time in our lives. And why not get ahead of it and get as much information as you can and make the best decision you can? And it's going to take usually a series of conversations with those closest to you, and then allow Hawaii Care Choices to come and be a part of that conversation. It's not easy, but I'm an advocate that we have to not overburden our already overburdened healthcare system by trying to say, if I go in a hospital and they tube me up, I might get 3 more months or 6 more months. But if I at home, you know, you still might get 3 or 6 more months in a completely different pool setting. And so I would encourage people to really think hard about making what would seem like a difficult decision. But I bet once they come to Hawaii Care Choices, ask the tough questions, get the answers they're looking for, speak to different people in the program who understand it better, that they'll walk away going, wow, that's an easy choice to make. It's almost a no-brainer. So that's my goal.
Really wonderful, Billy, that you were sharing that. I do have a question for our participants, explaining, you know, in our culture, we're taught to be strong. Lonnie, you know, we kind of touched on that a little of our culture and taking care of our own family, our kupuna. How, as a family, do we deal with a parent who refuses to have anyone come into the home?
Oh, you asking me?
Yes.
That's really tough, you know, especially kupunas, right? Because what you gonna say, it's kind of their call. But yeah, you know, local style, it's certain things real personal. You know, talk about finances to other people. You know what I mean? You know, talk about personal, intimate relationships with other people. And you know, kind of talk about your medical condition or death with other people, you know, or dying or passing away or however you want to call it. It's not something we traditionally seem to be comfortable engaging in. But what I would say is I would explain to a kupuna that, you know, go get the information from Hawaii Care Choices to make it an easy, common sense, like, hey, auntie or uncle or mom, dad, grandma, grandpa, you know, I don't like talk about something you don't like talk about, but I think we got to talk about this. And here's a couple options and alternatives. We can go this way, we can go that way, or we can go this way. But if we go This way, with Hawaii Care Choices, these are all the benefits and that come along with it. And this is what makes it easy for you and for everybody else. I think when there's an understanding that Hawaii Care Choices makes it easy on everybody, not just the client, not just the patient, but everybody, I think more families would be comfortable doing it.
That was so great in answering that. Thank you so much, Billy. I just have so many people chatting in that they just want to say thank you for participating. Hawaii Care Choices wants to thank you for participating. Many participants said it's so good to hear from you. A few comments that are coming in.
Right on. Hey, thanks, Letitia. Thank you, Lonnie. Thanks, Rodney, for the work.
Thank you so much.
Really?
For our community. I love you guys. I love everybody in that program. And anything I can do to help Hawaii Care Choices provide excellent service in our community, I'd be honored to do so. Thanks, you guys. Take care. God bless. And aloha.
Thank you so much, Billy. Mahalo.
Yeah.
Oh, mahalo, Billy.
Well, again, everyone, thank you so much for joining. We are coming up to 5 more minutes before the end of our presentation. And there we have last survey that I'm just going to launch. This is your survey of your experience with Hawaii Care Choices and our presentation that Lonnie has shared. These results will be anonymous and they will not be shared. So feel free, and it's will not be shared. And you can put in any of your last minute thoughts. If you can just kind of plug in one thing into the chat box that you have taken from this presentation, we'd really, really love to hear from you. And I'll try and go ahead and just read off just a few notes or comments. Any last questions, please put that in the chat box as well. Rodney, I know there is one question. If there are specific questions that I need answers, who may I call if I have United Healthcare insurance?
Well, you can call our customer service number. You can always call me. I'm always available. We always have providers. I can actually give you guys my number. It's 959-5060. That's my direct line. So if you do have any questions about United Healthcare coverage, definitely give me a call. I'd be more than happy to go over it with whoever has a question. Our customer service number, if they want to call just directly for general questions about providers or benefits, is 1-888-980-8728. So that's definitely another way of getting in contact with UHC. Thank you.
Can you repeat those numbers again, Rodney?
Sure. My direct number is 959-5060. And then our customer service number is 1-888-980-8728.
Awesome. All right, we have a few last minute takeaways. Thank you so much, Hawaii Care Choices and United Healthcare, for partnering and having this available to our community. We have a great presentation and guest speakers were amazing. Thank you so much for that. All right.
Tish, on our survey, we have a total of 8 questions. Is that correct?
We do have a total of 8 questions, correct?
Okay, so people will need to answer all 8 before they can submit?
Yes, that is really good, yes. Please
okay, thank you.
All 8 questions, or your submit button may not work. So if anyone's having trouble with the submit button, it might be because there are questions that were unanswered. Thank you.
Any additional takeaways coming in the chat box?
Yes, and they are coming so quickly. Another one participant said, gotta do this again. There are many others that need to hear this. So mahalo. We do these resource talks every 10th of every month at 10 o'clock. If anyone wants to join in, please give our main office a call, 969-1733. You can also visit hawaiicarechoices.org and go to our events page, and you can see what's happening. We'll have different guest speakers throughout the different months. So even if you joined in this talk or last month's talk, it will always be a little bit different. So just wanted to put that out there. Thank you for everyone that participated. This, again, has been recorded and will be posted up on our YouTube channel for Hawaii Care Choices sometime early next week. So anybody that you feel needs to hear that, you can go ahead and direct them to our page. It also has a link to YouTube if you visit hawaiicarechoices.org. Mahalo nui loa, Rodney, Lonnie, and Tish for presenting. You are very welcome. It's my pleasure. I know it's for Lonnie. Thank you, Rodney, for coming on here.
My pleasure. My pleasure. Thank you.
I'm completely blown away by Billy Kenoi.
Yes.
I mean, the words that he said were so from his heart, and he has such a long history with us that he just really embraced us with so much love. And as he says, love keeps winning. And so as a final thought, I really wish to send everybody off today thinking that love still wins. Thank you, everyone, for joining us. Yep, you bet.
Rodney, would you like to say any last words?
Oh, this was a wonderful opportunity. This was excellent. I was more excited for Billy Kenoi than my own part. So that's why I joined. I was like, yes, I get to hear from Mayor Billy. So but I appreciate the opportunity. Thank you guys so much. I've learned a lot today, and I appreciate the questions. Definitely would love to do this again if you guys would love to have me back. Thank you.
Thank you so much, Rodney. I appreciate it.
Thank you. Lonnie, just a quick one. I know multiple people are asking, what is in store for August talk?
So we will continue to have somebody that we collaborate with, and probably next month will be Hilo Medical Center. So we'll have them. And then we're going to have another surprise guest out from the community. And the reason I love putting those two together is because it's important to share the different perspectives on healthcare now, and having somebody share their perspective from a patient or caregiver's perspective is really important. And so we like to also include that each month. So please tune in so you can find out who that special guest person is going to be. We look forward to having you again. And please spread the word, because once Tish gets something on her email to go ahead and send the invitation out, we will send it. And these talks continue to have larger audiences each and every month, and they are free, and they can be joined from the convenience and the comfort of your own home. So please spread the word. It's a wonderful thing that we love sharing with all of you. And it looks like we're right at time, Tish.
Yes, I agree. We are on time. Thank you. Mahalo, everybody, again, for joining us, participants. Rodney, thank you so much for your time. Lonnie, you as well. And we look forward to everyone else joining us on our next talk on August. Thank you.
Kenoi. Aloha.
Aloha.